and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman and here is what I bring to you all from the world of medicine. Soluble urokinase plasminogen activator receptors role in identification of blood clots for high-risk patients. An abnormal immune response is thought to be the major driver of severe COVID-19. One protein called soluble urokinase plasminogen activator receptor, or SUPAR for short, circulates in the blood and originates from immune cells and has been shown to play a major role in complications of COVID-19. Salim Hayek and a team of researchers from around the world have been studying SUPAR and its relationship to critical outcomes in COVID-19 cases. In a publication by the International Study of Inflammation in COVID-19, a multinational observational study of patients hospitalized for COVID-19, researchers found that higher SUPAR levels were associated with an increased risk of blood clot formation. Their new findings, published in the Journal of the American Heart Association, suggest that SUPAR levels in hospitalized COVID-19 patients were associated with venous thromboembolism, including pulmonary embolism, independently from a marker of blood clot formation called D-dimer. The authors therefore conceived that combining SUPAR, a marker of the immune system, and a D-dimer could improve the reliability of determining who is at high or low risk of blood clot formation among COVID hospitalized patients. In the study, researchers compiled data from 1,960 adults who were hospitalized for COVID-19 and who had their SUPAR levels measured at the time of admission to the hospital. All patients were monitored until they were either discharged or, in some cases, until death. Researchers measured D-dimer and SUPAR levels over a 30-day period during patients' hospitalizations and diagnosed VTE, that is deep vein thrombosis, and pulmonary embolism using ultrasounds of the lower extremities and scans of the lungs. Results showed that VTE occurred in 163 patients, and of those, 65 patients developed deep vein thrombosis, 88 patients developed a pulmonary embolus, and 10 patients developed both. Patients who developed blood clots had SUPAR levels nearly 50% higher than those who did not develop clots. And when SUPAR levels were combined with D-dimer, researchers could classify 41% of study participants to have low risk for occurrence of VTE. Now that the association is made between SUPAR levels and blood clot formation, clinicians could assess who is at high or low risk, which will help them decide what therapies to use to treat them. The link between social isolation and a death risk from stroke or heart attack. Social isolation and loneliness are associated with about a 30% increased risk of heart attack or stroke or death from either, according to a new scientific statement from the American Heart Association. Risk of social isolation increases with age due to life factors such as widowhood and retirement. Nearly 1/4 of US adults aged 65 and older are socially isolated, and prevalence of loneliness is even higher, with estimates of 22% to 47%. However, younger adults also experience social isolation and loneliness. A survey from Harvard University's Making Caring Common project describes Gen Z, or adults currently aged 18 to 22, as the loneliest generation. Increased isolation and loneliness among younger adults may be attributed to higher social media use and less engagement in meaningful in-person activities. Data also suggests that social isolation and loneliness may have increased during the COVID-19 pandemic, particularly among young adults aged 18 to 25, older adults, women, and low-income individuals. Evidence is most consistent for a link among social isolation, loneliness, and death from heart disease and stroke, with a 29% increase in the risk of heart attack and/or disease death, and a 32% increased risk of stroke and stroke death. Social isolation and loneliness are also associated with behaviors that negatively impact cardiovascular and brain health, such as lower levels of self-reported physical activity, less fruit and vegetable intake, and more sedentary time. Multiple large studies found significant associations between loneliness and a higher likelihood of smoking. The review highlights research among older adults aimed at reducing social isolation and loneliness. These studies found that fitness programs and recreational activities at senior centers, as well as interventions addressing negative thoughts of self-worth and other negative thinking, have shown promise in reducing isolation and loneliness. A new study which finds that almost 90% of people with opioid use disorder are not receiving life-saving medication. While the opioid overdose and death epidemic continues to worsen across the US, medications such as methadone, buprenorphine, and extended-release naltrexone are proven to reduce opioid overdoses by more than 50%. New findings led by researchers at NYU Grossman School of Medicine indicates the vast majority, or 86.6% of people living with opioid use disorder or OUD, who are not receiving these evidence-based life-saving medications. The study, published in the International Journal of Drug Policy, examined the gap between new estimates of OUD prevalence and the use of medications to treat opioid use disorder or MOUD at the national and state levels from 2010 through 2019. Although the use of MOUD has grown by more than 100% over the last decade, this rise in treatment has failed to keep pace with OUD and skyrocketing overdose mortality rates, largely driven by fentanyl, a potent synthetic opioid up to 50 times stronger than heroin. Our findings highlight the urgency of removing barriers to accessing medications to treat opioid use disorder while expanding the availability of these medications, says Noah Krozik, a lead author of the study. But what we have is a way beyond a simple treatment capacity problem. We need to rethink how treatment for opioid use disorder is delivered, eliminate stigma, make it easier for people to enter and remain in treatment, as well as ensure that all treatment programs provide and encourage use of evidence-based medications that we know save lives, she added. Ways to expand access to MOUD could include removing special waiver requirements so that more physicians can prescribe buprenorphine, as well as expanding the development of MOUD by mobile health clinics and community-based organizations and within the criminal justice system. Making methadone less controlled and more accessible through avenues other than highly regulated opioid treatment programs is also long overdue, said Krozik. Strong bone development in weight training vegans as compared to those on a plant-based diet. People on a plant-based diet who do strength training as opposed to other forms of exercise such as biking or swimming may have stronger bones than other people on a vegan diet, according to the new research published in the Endocrine Society's Journal of Clinical Endocrinology and Metabolism. About 6% of people in the US are vegans. Recent research shows a plant-based diet can be associated with lower bone mineral density and increased fracture risk. Veganism is a global trend with strongly increasing numbers of people worldwide adhering to a purely plant-based diet, said Christian Muchitz, MD of St. Vincent Hospital, Vienna, and the Medical University of Vienna in Vienna, Austria. Our study showed resistance training offsets diminished bone structure in vegan people when compared to omnivores. The authors compared data from 43 men and women on a plant-based diet for at least 5 years and 45 men and women on an omnivore diet for at least 5 years. Omnivores eat meat as well as plant-based foods. The research found vegan participants who did resistance training exercises such as using machines, free weights, or body weight resistance exercises at least once a week had stronger bones than those who did not. They also found vegans and omnivores who engaged in resistance training had similar bone structure. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.